Right here, new tonight at 6, Kentucky is getting more than $200 million to support reforms to rural health care. It comes months after President Donald Trump signed his big domestic policy bill into law, which included cutbacks in Medicaid funding, potentially threatening rural hospitals like one in Shelbyville. Isaiah Kim Martinez explains why this new money, what it means for your health care.
My baby, I love you.
While Alexis Cisney's maternal care center is based in West Louisville, she helps support pregnant women across Kentucky as a doula, including in the rural parts of the state.
Rural areas do not have access to proper maternity care.
Cisney, founder of Granny's Birth Initiative, is pleased to hear Kentucky will receive $213 million from the federal government over the next 5 years to reform rural health care in the state.
And these are the type of actions I want to see from the president of the country that I live in and I birth in.
She's from Bullitt County, one of 109 Kentucky counties considered by the state to be at least partially rural, therefore eligible to receive some of that new funding. It's part of a larger sum of money the federal government is distributing across the country, made possible by a provision in President Trump's Big Beautiful Bill designed to protect rural hospitals from the effects of Medicaid cuts. In the summer, U of L Health's Shelbyville Hospital was listed in one report as one of 35 rural medical centers in Kentucky threatened by reductions to Medicaid. Now, in a statement about the new funding, a hospital spokesperson said, quote, "While the full impact of recent federal policy changes is still evolving, this investment is an important step in supporting access to care for Kentucky communities."
It's trying to invest it into a new structure through these community health hubs. That's why I have faith about this money.
According to Kentucky Governor Andy Beshear's office, the money will go to improve maternity care and to address chronic diseases like obesity and diabetes in the highest need areas.
I was a woman looking for reproductive care in Bowling Green and didn't have it.
In a statement, Senator Mitch McConnell called the investment a major win, working toward a health care system, in his words, that's more sustainable. By the way, a U of L's health spokesperson, Doug, told me back in July that the Shelbyville Hospital has no plans to close. I checked back in on that today, and he told me that nothing has changed in that matter. They are open and will continue to be.
Well, anytime you get funding these days right now with the state of everything, it's good news. Is this going to be one lump sum? Are they going to get this $213 million all delivered to them at one time, or is there a caveat to this?
It's going to be over the course of 5 years, so we're going through 2030. I think what's unclear right now, to me at least, is, okay, what dictates which counties get more, right? Because as far as rural counties, Kentucky has over 100 of them, so who gets more, right? Is there a county on the far east side, you know, that those healthcare needs are greater? I think those are the questions we still have outstanding. Many of the officials New Year's week did not get back to us this week, so we hope to follow that moving forward.
All right. Thank you very much.